My name's Kirsten and I'm an occupational therapist. So I can work with people who are newly diagnosed or have maybe had the condition for numerous years. So that can be from a really early onset to a more moderate or advanced stage. Really the role of the OT is to promote independence in your activities of daily living. So it's really important that we incorporate different techniques in order for you to achieve that. One of the approaches that we might use would be goal-focused rehabilitation. So if you've got problems maybe with fine motor skills, dexterity and strength, we might do some work on that. We might provide information on how to grade and adapt an activity to make it easier for you to manage. That might be breaking it into smaller chunks or really changing how you do that activity to make it easier. We've got a key role in education. So I can help the person understand how Parkinson's disease will impact on their activities of daily living. You know, we'll maybe look at pacing, fatigue management. We can look at coping strategies if anxiety and stress is an issue. We can look at the routines of the day and how best to structure that so you're getting the optimum outcome of your activity. And we can also look at how visualisation, cueing, mental rehearsing can impact on your function and make it easier. The role of the OT is to look at the home environment as well as the social environment and look at the barriers to accessing those environments. Sometimes it's just about giving information about falls prevention, so we can look at your home and maybe advise on uplifting the rugs that you have, maybe looking at the flooring that you have, and it might just be the space or the layout in which you're manoeuvring in. We can look at where you're having issues mobilising or accessing a certain part of that environment. So it might just be providing advice on how to get from A to B, a clear pathway as opposed to negotiating lots of obstacles. Sometimes using a grab rail or a banister might be helpful. We might talk to our physio colleagues and ask about walking aids and what might be helpful there. And other times it's just about providing cues and tips on how to help with freezing and turning in a tight space. Yeah, so my initial assessment is about a good conversation. I use that opportunity to really gather information about home and how you're managing with your activities of daily living. So I might ask you things like how you're managing to get washed and dressed, managing your meal preparation. I'm interested in how you're mobilising around the house and transferring, as well as maybe your social interests and your hobbies. So transfers would be things like managing on and off your bed, on and off the toilet, maybe getting in and out of the bath or the shower. So I'm interested to find out how easy you can do this, and if it's a problem, we might need to look at equipment or some strategies to help you cope with it. People with Parkinson's can self-manage in numerous ways. I think really it's about incorporating everything that you're taught, so the strategies that we might provide, the equipment that we might provide, and the education that we give, so you encompass or you embed this into your daily practice, and that would help with your self-management of your symptoms. Sometimes equipment can be beneficial in maintaining independence. Things like moving in bed can be a problem, so maybe a piece of equipment to help with that, as well as using strategies and techniques to help too. We might provide a piece of equipment to help on and off the toilet, because going from sitting to standing might be an issue, or even just accessing the bath or the shower, because if you're standing and your balance is a bit precarious, you might want something to steady yourself. Referrals to occupational therapy are usually made from the wider multidisciplinary team. So it's important that they have a good grip on what we can offer and what we can do. Often a person will be talking about the things that they're struggling with at home, and it's usually the key words about getting washed and dressed, maybe transferring and moving around the house that's becoming more difficult, or even things like eating and drinking. That can become an issue, and that can be a bit of a flag. Then that's when maybe somebody would ask an occupational therapist to review that person and assess them. At the moment, we're working with people who are newly diagnosed in Parkinson's disease through a very specific clinic. What you find there is that the whole MDT can see those patients, so that we're picking up on problems quicker. And that's often more beneficial as a therapist, because we can start to provide advice and education at that point, It might not be that they need direct therapy or equipment or any sort of engagement, but providing that piece of advice earlier puts it on their radar, if you like, so that they know at some point they might want to access an occupational therapist.